personal protective equipment. We often hear this term, but how do we put it on and take it off properly? The hospital has these steps in wearing the PPE, which is also known as the donning and doffing. The term donning and doffing is used to refer to the practice of putting on and taking off protective gears, clothing, and uniforms, which include the gown, gloves, mask, goggles, and hairnet. Donning and doffing of PPE is a vital step in reducing contamination of healthcare workers who are caring for patients with transmissible infectious diseases. So these are the possible sequences in donning your PPE properly. First, put on the gown, then the mask, followed by the goggles, then the hairnet, and finally the gloves. And you should keep in mind that you need to don your PPE before entering the patient area. Hand hygiene must always be practiced before donning, as it is a critical step in the safe use of personal protective equipment. So the first step is to put on a gown. Slide your arms into the sleeves into the cuff of the gown and pull the gown over your head and secure the gown by tying the strings in the neck and waist area. It is important to ensure that the gown is sized properly and large enough to allow unrestricted freedom of movement. So the next step is to don the mask. Hold the mask by the ear loops and place a loop around each ear. After placing the loop, mold or pinch the stiff edge to the shape of your nose. And lastly, fold the bottom of the mask over your mouth and chin. After donning the mask, the next step is to put on the goggles. Apply the goggles over the eyes and ensure that the strands or bands are securely fastened around the head and that they fit properly and comfortably. So the next step is to don the hairnet. Stretch the hairnet so that it would be easier to cover the whole head, including the hair and the ear. Upon wearing it, hold the small ears on both sides with both hands and wear it from front to back. Hand hygiene should be performed before putting on gloves. With your non-dominant hand, pick up the glove by pinching the inside and outside of the cuff. Let the glove hang with the fingers pointing downward. Carefully slide your dominant hand into the glove and do not adjust the glove's position on your hand until the other glove is on. Repeat the same process with the other hand and ensure that there are no rips or tears in the gloves. After the donning process is the doffing process, or the removal of the potentially contaminated equipment. These are the possible sequences in doffing your personal protective equipment. Start by taking your non-dominant glove hand to grab the other glove around the cuff in the wrist area by doing a pinching motion to grab the glove off and turn it into a ball. Take the index finger of the ungloved hand and slide it under the cuff and peel the glove off the hand by pushing the index finger forward against the glove. Dispose the glove properly. Next is doffing the gown. Avoid touching the sleeves and front of the gown when removing. Unbind the ties in the waist and neck area of the gown. Peel off the gown by moving the shoulders and arms up through the gown, which allows the gown to slide off the body. Then from the inside, roll the gown away from the body by turning it inside out, form it into a ball and discard after. After that is to conduct a hand washing. After that is to doff the hairnet by grabbing the back portion of it and flip it upside down. Roll it and discard properly. Avoid touching the outside of the goggles for it is contaminated. Remove the goggles by carefully grasping and lifting the back band of the goggles over the head. Dispose or clean the goggles after. Lastly is to remove the mask by grasping the ear loops of the mask with the fingertips and remove the mask from the face. Discard the mask properly. Hand hygiene is vital after doffing the PPE to prevent contamination. And that wraps up this video on how to don and doff personal protective equipment.